What are the risk factors for schizophrenia in autistic adults? What are the risk factors for schizophrenia in autistic adults? This question is essential for understanding the intersection of autism spectrum disorder and mental health. Schizophrenia and autism spectrum disorder are different conditions, but they share some features and risk factors, particularly in adults with autism. First, let's talk about genetics. There is a notable genetic overlap between autism and schizophrenia. Research shows that about 15 to 25% of specific genes can increase the risk for both conditions. This suggests that some autistic adults may have a biological vulnerability to developing schizophrenia due to shared genetic pathways. Certain rare genetic variants, like copy number variations, have been linked to both autism and schizophrenia, indicating common underlying mechanisms. Next, we have neurodevelopmental factors. Schizophrenia is increasingly recognized as having a strong neurodevelopmental aspect, much like autism. Both conditions can arise from disruptions in brain development that affect social cognition and brain connectivity. Autistic individuals often experience challenges in social cognition, which is also a core feature of schizophrenia. These shared cognitive deficits may contribute to the increased risk of schizophrenia in autistic adults. Now, let's look at co-occurrence and prevalence. Studies indicate that schizophrenia and related psychotic disorders occur more frequently in autistic adults than in the general population. For instance, about 7.8% of autistic adults have been found to have co-occurring schizophrenia, and schizophrenia spectrum disorders may be present in up to 12% of autistic adults. This is significantly higher than in neurotypical populations. Family history and environmental influences also play a role. A family history of schizophrenia or bipolar disorder can increase the risk of schizophrenia in autistic individuals. Environmental factors, such as perceived social threat or victimization, may also contribute to triggering psychotic symptoms in those with autism. The way social experiences are processed differently in autism can influence the development of schizophrenia-related symptoms. Age and developmental stage are additional considerations. The risk for schizophrenia may relate to developmental stages. Some research suggests that autistic children and adolescents with specific risk factors are more likely to develop psychotic symptoms or schizophrenia later in life. However, the rates of conversion to schizophrenia among autistic young adults at high clinical risk appear similar to those in the neurotypical population, indicating that other factors also influence risk. Awareness of these risk factors can guide clinicians in monitoring for early signs of psychosis, especially in those with family histories or genetic risk factors. Supportive interventions that address social cognition and manage stress related to social interactions may help reduce the impact of environmental triggers. Genetic counseling could also be beneficial for autistic individuals and families with a history of schizophrenia or related disorders. Understanding these risk factors is important for early identification and tailored support for autistic individuals who may be at risk for schizophrenia.